Hello, my name is Anushka and this is my assignment on process improvement through EHR. The objective of this assignment is to analyze the information to manage a depressed patient based on his genetic information. The assumptions are patient has a depression, he has a healthcare insurance, and he has an access to internet services, and so does the provider. Also, the patient is aware that he is experiencing symptoms of depression. During the first call to the clinic, following information will be collected: patient's demographics such as name and date of birth, insurance information, medical history of the patient, and patient will also be scheduled an appointment with his primary care physician. During the first primary care visit with the patient's primary care physician, following information is collected: photo of the patient, insurance card, patient's medical record, or patient's medical history, symptoms that the patient is experiencing, and allergy information. Furthermore, patient is evaluated and given a medication, antidepressant. Patient is scheduled for a follow-up in a week to look at the medication if it works for him. Patient collects his medication from a pharmacy the same day. During the second primary care visit, patient is evaluated. However, the symptoms has not been improved. Patient is referred to a psychiatrist for further evaluation, and the appointment is scheduled for the following week. The patient is also advised to continue the medication until he sees a psychiatrist. During the first visit to a psychiatrist, patient's demographics, medical history, information on allergies and medication were collected. Additionally, reason for referral and insurance information were also collected. During the first visit to a psychiatrist, patient is evaluated. Genetic testing is ordered. Psychiatrist collects the DNA and sends it to the lab for results. The result for the testing will take 3 to 4 weeks, and patient is advised to continue with the antidepressants in the meantime. Second visit to a psychiatrist. The result from genetic tests are recorded in the EHR system, including more information on patient's health, including his visit summary. Patient is prescribed a new medication and is advised to stop the antidepressants. Patient collected the new medication from the pharmacy the same day, and he is asked to schedule an appointment for a follow-up in a week. During the third visit to a psychiatrist, the psychiatrist found out that patient condition has been improved, and he was advised to keep on taking the new medication. Subsequent visits. Patient can come for subsequent visit based on his need with his PCP. Patient is required to take the medication. All the patient's medical information, including test results, is shared with the PCP. Information exchanged among multiple actors. This table shows the information being exchanged among multiple actors: patient, primary care, psychiatrist, lab, and pharmacy. The information that is being exchanged are demographics, insurance information, symptoms, diagnosis, genetic testing, test results, and prescription. You can look at the table to see what information is being exchanged and with what actors. This is the flow of information between multiple actors in this case. PCP collects patient information. PCP then sends the prescription to pharmacy. PCP makes a referral to a psychiatrist. Psychiatrist collects genetic information and sends it to the lab. Psychiatrist then sends the new prescription to pharmacy. Lab sends back the result to psychiatrist, and psychiatrist sends all the medical information, including the test results, to the PCP back. Summary: patient information such as medical history needs to be recorded in the EHR. Access to patient's information for multiple actors is crucial in the treatment of the patient. Genetic information was used to find a treatment for this patient in this case. Use of process improvement technique reduces the number of visits for the patient, and it also encourages detail-oriented record of information in the EHR. Thank you.